Hartford Hospital is making history with a major advancement in eye care.
That's right. It is now the first in the region to offer a newly approved living implant that may help preserve vision in patients with a rare form of macular degeneration. That condition previously had no treatment options.
Very interesting. Joining us now to tell us more is Dr. Scott Walter with Hartford Healthcare. Doctor, thank you for your time.
Thank you so much.
Of course. Let's talk about this therapy and wow, what a breakthrough it is, huh?
Yeah, so, up until now, many of the treatments we had for macular diseases like macular degeneration and diabetic retinopathy relied on ongoing eye injections, often as frequently as monthly for many, many years. And for this particular form of macular degeneration called macular telangiectasia, there was no previously approved therapy. What's different about this therapy is instead of ongoing injections, we're able to offer a one-time procedure to implant a device inside of the eye called Incelto that works to continuously produce the therapy for the rest of the patient's life.
Doctor, without getting too technical about it, how does this implant actually work?
Well, the implant's about the size of a grain of rice, and it contains living human cells that have been bioengineered to produce a specific therapeutic protein that's actually naturally occurring in the human body. So once it's inside of the eye, the protein diffuses into the retina, the light-sensitive tissue in the back of the eye that's responsible for vision. And this leads to a reduction in the rate of retinal degeneration over time, allowing patients to preserve their vision for longer.
Interesting. And I want to backtrack a little bit here just because we may have some viewers who really don't understand. Can you just explain what macular degeneration even is?
So macular degeneration involves loss of tissue as a result of aging and other factors in the back of the eye that's responsible for the high acuity vision that we need to read, drive, and recognize faces.
Doctor, what does this advancement mean for Hartford Hospital and your patients?
Well, right here at Hartford Hospital, we were the first in Connecticut to implant this device in 2 patients about 2 weeks ago, and both patients are doing well. We're also one of the first centers in the region to offer this therapy ahead of major academic centers in New York and Boston. It's really more than just a milestone for Hartford Healthcare, though. It's really a breakthrough for patients around the United States living with macular telangiectasia, which up until now had no treatment. And as I mentioned earlier, these patients can lose their independence over time. So really, this therapy offers hope to patients in terms of preserving their ability to live independently, to relate better to family members, and to maintain the vision that's so important to their day-to-day lives. I'm really excited to bring this therapy here to Hartford, make it accessible to patients so that they can access treatment close to home and earlier when it matters the most.
That is wonderful. Wow. Thank you so much, Dr. Walter, for your time this morning.
Thank you for having me.
Thank you, Doctor.